Surveillance colonoscopy in Austria. Are we following the guidelines? Introduction. Colorectal cancer, CRC, is the second most common cancer in Europe and the second leading cause of carcinoma-related death. Many studies have shown that CRC screening is effective in reducing CRC incidence and mortality. If adenomas are found at the initial screening colonoscopy, the risk of developing further adenomas is high, and follow-up surveillance colonoscopy is recommended. The European Guidelines for Quality Assurance in Colorectal Cancer Screening and Diagnosis from the European Commission have been in existence since 2010 and contain recommended time intervals for follow-up and surveillance colonoscopy. In the European guidelines, findings at the index colonoscopy are divided into three groups. Low-risk group containing colonoscopies with 1 to 2 small, less than 1 centimeter, tubular adenomas with low-grade dysplasia. Intermediate group containing colonoscopies with 3 to 4 small, less than 1 centimeter, tubular adenomas, or at least one adenoma having at least one of the following criteria: 1 to 2 centimeter tubular adenoma, or villus, tubulovillus histology, or high-grade dysplasia. High-risk group containing colonoscopies where more than 5 adenomas were found, or at least one adenoma larger than 2 centimeters. The surveillance interval should be 7 to 10 years for the low-risk group, 3 years for the intermediate risk group, and for people at high risk, a repeat colonoscopy should be performed within 1 year. Studies have shown that patients have a 3 to 4 times elevated risk of developing cancer when post-polypectomy aftercare is insufficient. On the other hand, the systematic overuse of colonoscopies, which is currently seen in the United States, leads to cost ineffectiveness and to the exposure of patients to excess risk. Thus, determining, documenting, and recommending the correct surveillance interval after the index colonoscopy is very important and forms part of a high-quality screening colonoscopy. Several studies have found poor adherence to post-polypectomy guidelines, with a tendency to shorten recommended intervals. In 2007, the National Project Certificate of Quality for Screening Colonoscopy, CQSC, was inaugurated in Austria to define quality standards, as well as to control and improve the quality of screening colonoscopies conducted by voluntarily participating endoscopists. The aims of our study were to assess whether participants of the CQSC are following the European Guidelines for Quality Assurance in CRC Screening and Diagnosis, 2010, and whether sending a reminder letter that highlighted the importance of the recommendation for the correct surveillance interval, and which included the German translation of the European guidelines, resulted in better adherence. The authors further aimed to identify factors associated with poor adherence. Background and study aims. The European Guidelines for Quality Assurance in Colorectal Cancer Screening and Diagnosis contain post-polypectomy surveillance recommendations. They recommend follow-up intervals depending on the findings at index colonoscopy and divide patients into a low, intermediate, or high-risk group. The aim of this study was to assess the adherence of Austrian endoscopists to the European guidelines and to determine whether sending a reminder letter resulted in better adherence. Methods. A single reminder letter containing the guidelines was sent to all endoscopists who participated in the Certificate of Quality for Screening Colonoscopy program in Austria. Adherence was assessed before and after the letter had been sent. Factors associated with adherence were investigated. Results. The authors found poor baseline adherence to the guidelines. After the reminder letter, the adherence slightly improved in the low-risk group, but did not change in the intermediate risk or high-risk groups. An adenoma detection rate of at least 20% was associated with higher adherence rates. Generally, internists and hospitals showed better adherence compared with surgeons and private practices, respectively, both before and after the reminder letter. Conclusion. A single reminder letter was not enough to improve the poor adherence to the European post-polypectomy surveillance guidelines. Thus, future studies are required to identify and eliminate all factors responsible for non-adherence to post-polypectomy guidelines in order to reach the goal of a safe, effective, and cost-effective colorectal cancer prevention tool in the near future.